Hello, my name is Alice, and I would like to invite you all to this presentation and training module. In this audio, I will be discussing the nursing sensitive quality indicators and how healthcare systems are utilizing them. Additionally, I will also discuss the role of the interdisciplinary teams in data collection alongside reporting of the quality data. I hope you all enjoy this training module. National Database of Nursing Sensitive Quality Indicators. The National Database of Nursing Quality Indicators evaluates nursing care at the unit level and improving the work environment. The NDNQI publishes quarterly and yearly construction announcements, interactions, and outcome indicators. This data collection has not yet shown any relationship between the number of nurses on staff and the results of their patients. Smith et al. 2018 is the reference. This increasing data set, which includes data from over 1,100 workplaces in the United States and will continue to increase, will be used to illustrate the financial ramifications of different working levels. Nursing sensitive quality indicators. In nursing, nurse sensitive quality indicators, NSQIs, are measurements that consider the structure, process, and outcomes of nursing care and tracking patient outcomes and safety. Structure. Structure is associated with nursing levels of education and skills. Process. It involves assessments and interventions. Outcomes. It entails the standard of nursing care as well as the patient's results. In nursing care, nurse sensitive quality indicators are the assessment that take the structure, process, and outcomes of nursing care into account for the betterment of the patient. Structural indicators include the availability of labor, skill level, education, and certification criteria. Those who monitor process indicators may track patient evaluation, nursing interventions, and employee satisfaction. Smith et al. 2018 is the reference. Nursing sensitive outcomes are those in which it has been shown that the quantity or quality of nursing care provided affects the patient's well-being. Pressure ulcers, patient falls, and infections in the hospital are just a few of the problems that might arise. The National Database for Nursing Quality Improvement is the only database that produces annual and quarterly reports to measure nursing care quality. The indicators in these reports are recorded and analyzed by this database. Catheter-associated urinary tract infections. 550,000 people are diagnosed each year with catheter-related urinary tract diseases despite efforts to improve quality. Patients should not suffer from catheter-related urinary tract disorders since they are preventable and directly linked to the way nurses care for them. A fear of catheter-related urinary tract contaminations was the deciding factor in my selection since these illnesses are among the most often discovered in long-term care facilities. Park et al. 2020 is the reference. As mentioned above, 550,000 people are diagnosed each year with catheter-related urinary tract diseases despite efforts to improve quality. Park et al. 2020. As a result, catheter-related urine contaminations result in longer hospital stays, greater death rates, and increased medical expenses. Contamination of catheter-related urine plots is rising, posing a threat to patients' well-being. The primary goal of this study is to prevent urine plot contamination as a result of catheter use. Medical caregivers in a long-term care facility are uniquely positioned to help patients avoid catheter-related urine contaminations. Part et al. 2020. Patients should not suffer from catheter-related urinary tract disorders since they are preventable and directly linked to the way nurses care for them. Data collection interview. The interview was the natural choice for the data collection. Infection control nurses may determine Foley catheter insertions and durations by reviewing patient records. The ability of the floor nurse to record patient information precisely is an essential part of the data collection process. Our infection control nurse at the medical center was a natural choice for this assignment. The medical center uses weekly nursing unit reports and record reviews to track catheter-associated urinary tract infections. Infection control nurses may determine Foley catheter insertion locations and durations by reviewing patients' records. Because of incomplete or inaccurate documentation, the infection control nurse claims that chart checks may be time-consuming and complicated. Smith et al. 2018. Catheter-associated urinary tract infection statistics are inaccurate if the necessary information is not available and viable. The ability of the floor nurse to record patient information precisely is an essential part of the data collection process. Management, risk, and other stakeholders get monthly and quarterly updates on the aggregated data. Interdisciplinary collaboration in data collecting. To enhance patient outcomes, it is necessary to relate nursing-sensitive outcomes such as catheter-associated urinary tract infections to the participation of healthcare workers in reporting and data collecting. Multidisciplinary members must collaborate and show mutual respect to enhance the overall quality of care in hospital settings. As a result of the increased need to provide data that provides the quality of therapy, healthcare practitioners are increasingly focused on interprofessional cooperation. To enhance patient outcomes, it is necessary to relate nursing-sensitive outcomes such as catheter-associated urinary tract infections to the participation of healthcare workers in reporting and data collecting. Multidisciplinary members must collaborate and show mutual respect to enhance the overall quality of care in hospital settings. Liu et al. 2020 is the reference. For example, multidisciplinary teams prepare to shift change reports on catheter-associated urinary tract infections as a common occurrence. When all shifts have accurate and thorough patient reports, the reliability of quality indicator data is increased. Data dissemination. Electronically dissemination of data, non-proprietary open systems through Internet protocols. The data collected from various interdisciplinary collaborations are usually disseminated electronically, transmitting a recording or a video production through the Internet or other digital networks. The other way is through non-proprietary open systems through Internet protocols. Evidence-based of data collection guidelines. Patients' health outcomes may be measured using nursing-sensitive quality indicators. Process, structure, and results may also be examined in investigating nursing-sensitive quality indicators. Patient health outcomes may be measured using nursing-sensitive quality indicators. Using the national database of nursing quality indicators, healthcare facilities may assess their performance against their competitors. Data alone isn't sufficient, though quality improvement and evidence-based practice can only be achieved with data. Identifying and resolving problems with patient care and outcomes is a critical first step for every company. Process, structure, and results may also be examined in investigating nursing-sensitive quality indicators. Smith et al. 2018. This research will allow us to apply measures that are supported by evidence, such as hand washing and sterile techniques. In conclusion, it is possible to evaluate the effect and kind of nursing care provided via nursing sensitive quality indicators. The nature of our direct patient concern as attendants has a significant impact on the results of our patients. Patients place their faith in medical therapy that gives them high quality, safe care and results that are always improving. Keeping track of the nursing care delivered and ensuring its safety is more important as medical care develops in complexity and expands into new realms. Again, my name is Alice Hill, and I hope you have enjoyed this audio module. Thank you.